The government of Sierra Leone, through the Ministry of Health and Sanitation, commemorates this year World Malaria Day by officially launching the malaria vaccine in the country. The event, which took place at State House in Freetown, saw His Excellency President Dr. Julius Madapio, the President of the Republic of Sierra Leone, serving as the keynote speaker. During the event, Professor Dr. Charles Senesi, the Deputy Minister One of the Ministry of Health and Sanitation, reiterated the ministry's commitment to eradicating malaria in the country.
On this auspicious occasion of World Malaria Day, it is an occasion that highlights the need for continued investment and sustained political investment and commitment in malaria prevention and control. Historically, it was introduced by WHO member states during the World Health Assembly of 2007. On this World Malaria Day, we come together under the theme Accelerating the Fight Against Malaria for a More Equitable World. Everyone has the right to quality, timely, and affordable services, access to services to prevent, detect, and treat malaria. Yet this continues to be a challenge up to today and not a reality for all. The latest World Malaria report shows that malaria continues to claim the lives of hundreds of thousands of people each year, with the African region carrying the brunt of the statistics. Children under 5 are particularly vulnerable, with nearly 80% of malaria deaths in the African region occurring in this age group. We are having challenges to stay on track to reach the global target set by the WHO for reducing malaria cases and mortality rate by 2030. But despite this, we continue to do everything in our own power to achieve this goal.
Dr. Mada Kangbai, the program manager for malaria prevention at the Ministry of Health and Sanitation, provided an overview of the immunization program for children under the age of 5 for the malaria vaccine.
The expanded program immunization is one of the technical programs in the Reproductive and Child Health Directorate of the Ministry of Health that is responsible for immunization in Sierra Leone. As part of the comprehensive primary health care services of the Ministry of Health, immunization services have been reliable and consistent, provided in all public and faith-based health facilities across the country. This has been the due diligence service of the Ministry of Health through the EPI program since 1964. Immunization services are provided in temporary fixed site outreach and mobiles to hard and even hard-to-reach areas. The EPI has carried out several successful rollouts of vaccines over the past years, especially the COVID-19 vaccines, the human papilloma virus vaccine, and of course, recently also we gave the Ebola vaccine, and now we are here today to launch the malaria vaccines.
Liv Ellen Indiran Aitin from the UNICEF expressed gratitude to the government of Sierra Leone for being the first country in the sub-Saharan Africa to distribute the malaria vaccine and pledged to work closely with the government through the Ministry of Health and Sanitation in this endeavor.
Today marks a significant milestone in the fight against malaria, a life-threatening disease that is the #1 killer disease in Sierra Leone and is responsible for 1 million hospital visits every year. 25% of deaths in children under 5 are due to malaria and related complications, such as anemia and malnutrition, just to mention, and all of this in 1 year. The malaria vaccine introduction marks the end of several months of careful planning by the National Immunization Program of the Ministry of Health with support from development partners. The vaccines were procured and delivered by UNICEF with funds from Gavi and technical support from WHO and other key partners. UNICEF and WHO fully supports the Ministry of Health's efforts to expand the immunization schedule and recognizes the introduction of malaria vaccine as important milestones towards achieving the Sustainable Development Goals.
Brian Hunt, the United States ambassador to Sierra Leone, also commended the government of Sierra Leone for prioritizing malaria prevention and assured the continued support from the United States government.
I'm pleased to join you today to commemorate World Malaria Day and to participate in the long-anticipated launch of the malaria vaccine in Sierra Leone, a truly exciting scientific breakthrough that, as the minister said, will save lives. The malaria vaccine that we are rolling out today truly has the potential to change the trajectory in our fight against this deadly disease, and it will protect Sierra Leone's children from the most severe and deadly effects of malaria. I'm very proud of the United States government and the government of Sierra Leone's continued partnership to protect people from malaria and to support healthy communities across the country. Our joint work to ensure timely and universal distribution of malaria tests, fast-acting medicines, and insecticide-treated nets has already saved countless lives.
The country director, Chadi Sylvester Sir, one of the strong partners to the Ministry of Health and Sanitation, also pledged their continued support in the fight against malaria in the country, and also commended His Excellency President Dr. Julius Malabio for his government's commitment in making sure that children under the age of 5 are well cared for.
As a global health organization dedicated to saving lives and alleviating the burden of disease in low and middle income countries, the Clinton Health Access Initiative is deeply committed to working alongside governments and the private sector to strengthen their health systems and promote sustainable healthcare solutions. Malaria, as we've all heard, continues to pose a significant public health threat, not just in Sierra Leone, but also across most sub-Saharan African countries, particularly affecting children under the age of 5. Despite considerable progress and ongoing control efforts, it persists as a leading cause of illness and mortality, responsible for almost 40% of child death in Sierra Leone.
In his keynote address, His Excellency President Dr. Julius Malabio said the launch of the malaria vaccine in the country marks a significant step towards combating the deadly disease and improving the health of the population. He also reassured the commitment of his government towards the fight against the malaria disease in the country, and also thanked development partners and the Ministry of Health and Sanitation for celebrating this year World Malaria Day and also for the launch of the malaria vaccine in the country.
We shall continue to conduct periodic mass IT-end campaigns to ensure optimum access. For instance, in February 2024, we distributed 4.8 million insecticide-treated nets nationwide for the first time using digital technology. To further increase nationwide ITN coverage, we plan to distribute ITNs to primary school children through school-based programs. To reduce the disease burden, intermittent preventive treatment is provided to pregnant women during antenatal clinics and to children during immunization services. We have also embarked on indoor residual spraying in moderate and high malaria disease burden districts. These interventions have resulted in a significant reduction in malaria case incidence among children under 5 years old, from 1,032 in 2019 to 7,754 per 1,000 in 2023, representing 27% reduction in case incidence.
The highlight of the program was a conducted tour done by His Excellency President Dr. Julius Malabio of some of the booths and a symbolic administration of the vaccine to a child. For Star TV News in Freetown, I am George Elliott Sam reporting.